Hello, welcome to Path First, Path Presents at the Forefront virtual presentation. Today's theme is ending homelessness during crisis, and we are live on Facebook, YouTube, and Eventbrite. My name is Joel Roberts, and I'm the CEO of Path and Path Ventures. Nearly 37 years ago, a group of compassionate community members on the west side of Los Angeles created a small nonprofit agency that would help address the growing homeless crisis in their neighborhoods. They called this agency PATH, People Assisting the Homeless. Some of these community members are still connected with PATH, either as board members or supporters. They used to tell me when they first started PATH, they thought they could solve this homeless issue within a few years. People just needed a hand up. But if we fast forward 37 years, and today, sadly, homelessness has not been solved. And PATH has grown into a statewide homeless services and housing development agency working in 140 cities and serving nearly 20% of California's homeless population. And this year, 2020, has become an unprecedented period of time throughout our world and throughout the world of homelessness. While Everyday Path and hundreds of other homeless agencies across the state have for years been helping our most vulnerable neighbors end their personal homelessness, this year seems to have placed incredible barriers for our vulnerable homeless neighbors and for those of us who are working to help them. Who would have imagined back just 6 months ago that a worldwide pandemic would sweep the globe and sweep into our neighborhoods and streets where our hurting neighbors live, especially those on our streets who are older with chronic illness, who are truly, truly vulnerable to a deadly virus. The solution to this pandemic was a shelter-at-home order. But how do people shelter at home when they have no home, let alone shelter? And incredibly, during this health crisis, who would have imagined that a Black man on the streets of Minneapolis would be cruelly murdered by a police officer, causing nationwide racial inequity protests that our country has not seen for decades? Some of us in the world of homeless services and housing knew that our mission to end homelessness was not isolated from this country's racial inequity. Black Californians represent 6.5% of the total population, but 40% of the homeless population. This disproportionate fact, this racial inequity, has become a wake-up call for all of us. Homelessness is not just a housing issue anymore, but also a racial inequity issue. So here we are today, addressing homelessness in the middle of a health crisis, in the middle of a racial inequity crisis, and soon to be significant economic crisis. But let's not forget, homelessness has been the significant and heart-wrenching American crisis for decades and decades, way before 2020. Despite all that is going on, today's discussion will center around hope, not despair. You will hear from leaders on the front lines directly serving or advocating for a new normal, and that is ending homelessness during crisis. Now I want to turn to Jennifer Hart-Dietz, our Deputy CEO and PATH Executive Director, who will kick off our discussion. Jennifer?
Thank you so much, Joel. And it's wonderful to be here with all of you at the forefront today. As Joel mentioned, this is the first in our series, and our goal really is to connect with you all on the critical issues that are facing homelessness and housing throughout the state of California. Today, we have two panel discussions focusing on two of the crises that Joel mentioned. The first is the crisis surrounding health, and the second is racial injustice. To start off on the health crisis, I want you to think back to over 4 months ago when we started hearing about coronavirus and COVID, and quickly they became commonplace words. As the pandemic began raging throughout California, it threatened everyone, but it put our homeless neighbors at even higher risk. The spike in infections caused safer at home and shelter in place orders, and we continually heard the motto to flatten the curve. These mandates are inherently difficult or impossible for people living on the streets to follow. To discuss this in more detail, I am excited to announce our panelists. Dr. Lynn Fitzgibbons is an infectious disease expert with Cottage Hospital in Santa Barbara, one of our critical partners combating homelessness in the region. Dr. Fitzgibbons also oversees our recuperative care program in Santa Barbara, and we are so grateful to have you here today. We are also joined by Aiko Yep, who is our Associate Director in San Jose. She oversees our supportive housing community, Villas on the Park. She previously led our extensive outreach programs throughout the region. And I want to highlight that Aiko has actually been with PATH for over 8 years, and we're so grateful for your leadership and for you joining us today. So to start off, Dr. Fitzgibbons, can you share a little bit with us about what you and Cottage Hospital have been doing as our partner in PATH Santa Barbara to ensure that people experiencing homelessness did not contract COVID-19?
Absolutely. Thanks for having me today. I don't think that the answer really starts with the beginning of COVID. And so what I mean by that is we've really enjoyed a long and incredibly strong partnership between our local community hospital, Cottage Hospital, and our PATH partner in taking care of the most medically fragile patients in our community through a variety of efforts, probably the most important being our recuperative care program. It's with that as a foundation that we entered this pandemic. And what did that mean? What it meant was we had this, again, amazing partnership, amazing collaboration between our clinical nursing experts, our cottage health nurses, who actually work on site, shoulder to shoulder with the phenomenal PATH staff, taking care of our neighbors experiencing homelessness. And again, as I mentioned, often some of the most medically fragile people in our community. What that meant was, as COVID came, it struck our community quite hard in March and April, settled a little, and has, of course, again, returned in the way that we're feeling throughout the state. And Santa Barbara is no exception. And what that means is we've had this, again, incredibly, I think, productive, helpful set of interactions between our cottage staff and the PATH staff, really on a day-to-day basis, to be able to support, to educate, to guide when we've had a circumstance where someone feels unwell and needs to be rapidly assessed, or if there was to be a concern for a positive case. Again, having, I think, this collaboration has led to very, very quick and I think important results for the sake of not just the health of the PATH community, but I think the community really at large. And so I think I'll just finish by saying I think the challenge with COVID, I think would be so much worse in our community, particularly among those who are experiencing homelessness, if we didn't have this incredible foundation and partnership with PATH. And so just opening with a gratitude there.
Thank you, Dr. Fitzgibbons. We're so appreciative of you and Cottage as well. And I'd love to hear a little bit more about, why is it so important right now to protect our neighbors experiencing homelessness?
Great question. Because they are our neighbors, I think is the simple, easiest, and the first right answer. These are our neighbors. These people live with us. This is our community. We must take care of our community. Stepping back, though, I do think from the perspective of an infectious disease physician, this is not the first time that we have an infection that disproportionately impacts our homeless neighbors. We, of course, have had infection after infection throughout really decades, longer, where we have, again, the most medically fragile, most vulnerable people within a community impacted. And COVID, unfortunately, has been no different. Whatever corner of the community you're discussing, addressing COVID square on is critically important. We talk a lot about the vulnerabilities of congregate living environments, like a skilled nursing facility. But of course, for people experiencing homelessness, whether it is within the walls of a phenomenal institution like PATH, or some of PATH's partner organizations doing similar work, or whether it's simply out in the community and huddling together, living together, our residents, our neighbors who experience homelessness are, again, not just more likely potentially to be exposed to this virus, but unfortunately, due to many of the medical comorbidities, meaning other illnesses that these people who are, again, are struggling with not just homelessness, but also perhaps with complicated medical problems. This unfortunately puts people who are experiencing homelessness not just at risk of more COVID infections, but when they do contract COVID, potentially more likely to experience more complications or even a worse outcome.
Yeah, thank you for highlighting that. I'd like to turn now to Aiko and see if you could share what has PATH been doing over the past 4 months to ensure that our homeless neighbors don't contract COVID-19.
From the very beginning, PATH has been at the forefront of efforts to ensure our homeless neighbors don't contract COVID-19. And these efforts are really focused on meeting the immediate safety and health needs of the people we serve, increasing access to hand washing stations, distributing food and water, masks and gloves, providing referrals to motels and shelter programs like Project Roomkey, linkages to mobile medical units, and then distributing up-to-date information about testing, symptoms, and importance of social distancing between people and between tenants. Often, our clients utilize public spaces like libraries to charge their devices, and a recent donation of solar chargers has allowed our clients to keep their devices charged as we continue to shelter in place. At PATH San Jose, at Villas on the Park, which is PATH's first Bay Area permanent supportive housing development, we finished leasing up just weeks before the shelter-in-place order was issued. And moving into a permanent home after many years of homelessness is a big change. Moving into a permanent home and then being asked to shelter in place was an even bigger transition. And those other effects of sheltering in place, like social isolation, decreased access to mental and medical care, and food insecurities, caused a great disruption in our residents' lives and impacted the person's mental, emotional, and physical wellness. So these have been some of the areas that our on-site services teams have really been working hard to address so that the people we serve are not only staying safe from COVID-19, but staying well as they're sheltering in place.
Thank you again, Aiko, for that, and for the full team for really adjusting the policies, the procedures, how we work through all of our programs to keep everyone safe. Back to Dr. Fitzgibbons, we've seen the COVID-19 numbers start to rise, and I know particularly we've seen that rise in Santa Barbara. Can you identify anything that went wrong within the state you'd like to share?
I don't know that I would say that anything went wrong, but let me explain, I think, rather how we got to where we are. We had a surge of cases in Santa Barbara as well as throughout the state in really March and April. And in response to that, we had a community, a statewide community, policymakers who responded quickly and assertively and really battened down the hatches. We closed. We absolutely closed. And what we did was we demonstrated that those actions were effective. We saw a downturn in our transmission throughout the state, including in many of our bigger urban areas. What we didn't do, though, is we didn't achieve a community condition whereby this virus was gone. And what that meant was there was ongoing community transmission, but at a lower level. And what happened, as we all know, as we've all now lived through, is over the last 1 to 2 months, things slowly opened. And many of us were so grateful for that. We were able to get back to some semblance of life. We connected with one another in ways that, again, we all adjusted for our own level of risk tolerance. But we connected and we interacted. The economy started to open again. And with that, of course, in the context of this underlying ongoing community presence of this virus, unfortunately, what we now know is that this virus really got a strong foothold in so many of our communities that when those interactions really accelerated, so did the virus. Certainly, there's been an increase in testing, and that I think has been very helpful. Unfortunately, we don't actually have as much testing as most infectious disease physicians would like right now, but we are absolutely testing more people. The reason we know that the numbers we're facing today are far more complex than just an increase in testing is, of course, what we're seeing in hospitals. We are seeing really day over day record numbers of hospitalizations. And what we know is that following hospitalizations, we inevitably see deaths from this virus on the population level. I think many have been following nationally what's happening on the population level with regards to deaths. And the good news has been for the last couple of months, the numbers had been decreasing. And that, of course, started to change in the last week. And here in California, again, we are certainly seeing deaths every day throughout our state. The biggest challenge going forward is of course, if we were to do anything other than the batten down the hatches approach from March and April, if we were to do modifications, what impact is that going to have on trying to, again, create a counterforce to really try to drop some of these new case records that we're hitting week over week? And I know that's what our policymakers, our elected officials, our public health leaders are struggling with literally every minute of every day right now.
Thank you for sharing that perspective and appreciate your overview. I want to turn back to Aiko now. So PATH and PATH Ventures staff are considered essential workers. And I'd love to hear from you. What have the PATH San Jose staff been experiencing? How have they been handling this crisis?
PATH services from the beginning of this order were deemed essential, and our providers across the state stepped up to this challenge, continuing to come to work. I think as providers, we're often exposed to the emotional roller coaster that can be part of the housing search process. We're together with a client, we'll locate a unit, the client is excited, and the unit is leased to another applicant. We'll locate another unit, it's even better, and it's leased to another applicant. And during these times, we talk about staying grounded so that we can stay present for our clients who may be experiencing these ups and downs. The COVID-19 curve with its rises and falls can similarly feel like a roller coaster. But I think that one of our team members reflected so well our outlook when he said earlier this week, in response to Monday's new statewide restrictions that do impact the work that we do, he shared, I feel deflated, but I'm rolling with it, and we've just got to get creative. We're not going to give up, and I think it's this unrelenting, forward-moving attitude that has allowed us to push forward and rise up to these challenges to serve the people that we work with. In my own life, the shelter-in-place order was issued as I was at home on maternity leave with a 1-month-old baby. And suddenly, all the family care plans that we had in place for when I returned to work in April were all awash. My parents, who had planned to come stay with us for a month, never got a chance to come, and they have yet to meet their now 5-month-old grandbaby. The 3 days that my husband works from home and the 2 days that I work from home make up our childcare schedule for the week, which means that the bed that my baby is playing on is now my new work desk, that I have a phone in one hand and a bottle in another, and that any afternoon virtual meetings that are taking place are with a camera focused on here and up, because here and down, baby isn't a baby carrier, because that's the only place he's willing to take his afternoon naps these days. And I think that now more than ever, it's important for us to take care of ourselves so that we can continue taking care of others. And PATH has just done such a wonderful job of providing a multitude of virtual platforms for us to connect statewide and talk about wellness, talk about mindfulness. I really appreciated the flexibility with remote scheduling so that I can continue to do the work that I love while keeping safe the people I love. And I think each of us in our own ways are doing our best to figure out this work-home life balance during these unprecedented times.
Thank you, Aiko, for sharing your personal experience and for your leadership. For my final question for both of you, what do you think this health crisis does as it relates to our cause to end homelessness? Do you think it hinders our cause, or do you think it furthers our cause?
I think it furthers our cause. I think we have so much opportunity ahead of us. I think there are certainly unforeseen challenges and barriers, but I think the future is bright, and I think there is, I think, just so much opportunity to take good care of one another, as Aiko said nicely.
And I also believe that this health crisis furthers our cause to end homelessness, because COVID-19 isn't only a health crisis, it's a social crisis, an economic crisis, and a human crisis. These social challenges that existed prior to COVID-19, like our housing and homelessness challenges, I think we have no choice but to continue furthering our cause. And our work is always focused on identifying those most vulnerable to dying if left to continue living on our streets. And COVID-19 has only intensified the urgency of the work that we do.
Thank you both so much for your participation today and your expertise. You both truly are on the forefront, and I appreciate your time today. I'm going to turn it back over to Joel for the next panel, and look forward to talk more later.
Thank you, Jennifer. As if the COVID-19 crisis was not enough to deal with, our country and PATH and other homeless agencies experienced one of the most significant historic civil unrest in years. After the murder of George Floyd, hundreds of thousands of Americans hit the streets to march against racial inequity. We're going to discuss this with Shane Goldsmith, who is the CEO of Liberty Hill Foundation in Los Angeles, and Hanan Scrapper, who is the regional director of PATH San Diego and oversees about 120 PATH team members in San Diego. Let's start off with you, Shane. I know Liberty Hill funds and provides leadership for advocate groups. Could you just share a little bit about Liberty Hill, and then share why is this period in history different than past efforts to address racial inequity?
Sure. Well, I'm really happy to be here. I also serve on the PATH board, as you know, and I'm very honored to do so. Liberty Hill Foundation is a social justice foundation. So much like Robin Hood, we raise money and we give it away to folks in low-income communities of color who are leading powerful efforts to change the systems, policies, and practices that impact their lives, all working toward racial and economic justice. So we believe that the people who are most impacted by the problems, the people closest to the pain, are the ones that need to lead the fight to make the changes to improve their lives and the conditions of their communities. And I think what is different about this moment in history is that it seems to be winning over the hearts and minds of many more people than I have seen in other times. Often there's more of a backlash, or it just doesn't seem to penetrate the sort of collective consciousness. And I think what we're seeing now is that people really are willing and able to see how deeply embedded racism is in the fabric of our country and in all of our systems, and are willing to take some action to repair that and to build a better world for all of us. And I think, you know, shame on all of us if we can't figure out how to take the passions and the outrage that are being unleashed right now and turn it into positive change that advances racial justice.
Thank you, Shane. Nan, welcome to our first presentation.
Thank you.
Even before this current crisis, statistics in California, as I shared at the beginning of this presentation, showed how Black Americans are 6.5% of the California population, but consist of 40% of the state's homeless population. How do you think, how has this disproportionate, inequitable fact affect our homeless neighbors you serve?
Thanks, Joel. So it's been, it's really difficult for us to address the disproportionate number of Black Americans experiencing homelessness in our community without really talking about structural racism and systemic racism that impact all of our clients, not just in homeless settings, just in daily lives and how people live. So many of our clients for years have experienced this racism, and Blacks, Indigenous, and people of color typically don't have the, in some situations, access to the resources that would really prevent them in becoming homeless. But it's not just a lack of resources, but also looking at the social support system that they have or what they don't have, and being able to actually resolve their homelessness prior to them experiencing it. And we've seen it for years as we've been doing this work that, in San Diego alone, we serve 28% of our clients are African Americans, and looking at historically how they got there. And in some situations, they've been marginalized for many years. And we're talking about hundreds of years. And that inequitable fact in itself shows us in how our clients feel in being able to resolve their situation, that sense of hopelessness that things won't change, this system and the structure that has for so long, discontinued our Blacks and minorities or people of color, and that impact it has on their mental health and physical health and just overall well-being as human beings when, you're treated less than, and those resources aren't equitable and available equally to all who are experiencing homelessness. So I think there's been a lot of conversation with our clients and how they've been feeling, but more than anything, it's opened up these, unhealed wounds that, we haven't talked about. And so it's allowing us to really be creative about, let's talk about what we're seeing in our community, the civil unrest, and what we can do to change that. So the dialogue has been really rich, and we're hoping that we can be part of that solution as well.
Thank you, Hanan. Shane, one of my favorite programs of Liberty Hill Foundation is a program that has been going on for years, and it develops leaders among young Black and Latino boys. In fact, former President Obama came to Los Angeles to speak with some of these young men. Why is this program so important to the work of fighting racial inequity? And without providing a program that instills hope for these young men, do you think they could end up being homeless?
Yes, we brought together boys and men of color, especially youth activists across Los Angeles several years ago, to ask them, what is getting in the way of their success. And one of the key things they identified was that they were getting suspended from school for something called willful defiance, which is an undefined term that was mostly targeting Black and brown boys, and they were being suspended and expelled at really high rates. So we provided resources, training, and grants to their organizations, and they led a campaign to end that practice in LA schools. And as a result, suspensions for that purpose all suspensions have reduced by over 70%, which is a huge impact on Black and Latino boys. And what we also figured out during that time is that once a kid gets suspended, especially a Black or brown kid, their chances of going to jail, becoming homeless, increase tremendously. And so by reducing suspensions, not only can we increase graduation rates, but prevent homelessness and future incarceration. And this campaign was led by these young men and women. Actually, many young men and women led this. And so when President Obama found out about it, he wanted to meet some of these young people himself. And I got to be there with about 5 of them when he shook each of their hands and looked in their eyes and said, "Thank you. Thank you for your leadership. Thank you for what you've done for all of us. And I expect great things from you." And I felt like I was watching their lives change forever in that moment, as they were being recognized by someone they respect so much, who looks like them, who is telling them that they could be leaders. And in fact, they've all gone on to be leaders. And I do think that without giving young people an opportunity to be the leaders that they are destined to be the brothers and fathers and sons that they are destined to be, that the chances that they will end up homeless or in jail are too high.
Thank you, Shane. I mean, that's part of changing systemic racism, that kind of a program. Hanan, PATH currently has over 700 staff team members across the state. And as you know, and as we know, a majority are people of color. Could you just share with us how the murder of George Floyd and the marches and unrest that followed? I know there were many marches and protests outside of our facilities across the state. How has all this affected the PATH staff? And even how has it affected you?
So as it relates to our staff, I think there's a lot of, as you mentioned, we have a large percentage of our staff who are Black and people of color, and there's a lot of frustration and anger that we're still fighting this fight, and that we're still experiencing injustice and racism, and the murder of George Floyd really unraveled what our nation has been okay with and moving through without really acknowledging, and that kind of mobilized people and being able to say, where do I stand and what do I want to do about this? And I know a lot of our staff, including myself, did their own march and protest and really use their voice to share how they're feeling, but also it was an opportunity for us to come together as humans, right? Outside of what we look like on the, as white, Black, brown, yellow, but on the inside of from a humanistic approach of this is injustice and this isn't okay. So what can we do to make that change? And so what we did, for example, in San Diego is really creating that space within each of our programs to have conversations of how each of our individual clients are feeling, but also the staff are feeling. But with the staff, it's not just really looking at our Black staff to say, you're the expert and tell us what to do, and not tokenizing, but really having that space, regardless of how uncomfortable the conversation can be, to say, it's okay, let's come together as as humans and talk through what we can do to hear you, see you, and that we will fight with you through this injustice. And I think that's been really helpful for everyone. It's not to say we've come to a place where we're all, good to go. We're resolving it, but this is the beginning, right? And the fight has been going on for so long. But I think, as Shane mentioned, it's caught such great attention. So many changes are coming from it, and we have that momentum. So how do we now shift it to the work that we're doing, the people we're serving, and really trying to make that long-lasting change and help us get to the mission that we have as an organization while addressing the systemic racism piece as well. So staff were able to really unite and come together.
And how has this affected you, Hanan?
Oh, me. Well, yeah, I was avoiding that. No, it's been really hard, and having these conversations, not just in a work setting, but in your personal lives, and people who you consider to be friends have such opposing views, and you're like, wow, how did we end up together? But also having conversations with my kids about what that means. Conversations about how we treat each other as humans, all regardless of what we look like and where we come from. And that's been really valuable. And I think for me, it kind of re-energizes us to okay, this is my focus. This is the work that I'm doing. But having this platform, this opportunity even today to speak on this is such a privilege in itself. So thank you.
Thank you, Hanan. Shane and Hanan, I just want to ask you one last question. Hanan talked a little bit about change. So how do you think this experience of George Floyd and marches and unrest and protests in the past couple of months can help change PATH? And not only PATH, but all the other homeless agencies that are trying to help people on the streets. How do we help PATH become even more of an effective movement to end homelessness? Shane?
Well, it's so beautiful to me that you're asking yourself that question. I think that's really just, of course, I would expect that of PATH, but I do think that, each of us taking this moment seriously and looking into our own hearts, into the organizations and communities where we have influence, and changing what we can is so vital, and that will add up to so much. And I think in terms of PATH, homelessness is in many ways a crisis of racism, as Hanan said. And so I believe PATH has a tremendous amount of expertise to offer Los Angeles and California in terms of how to go upstream on the issue of homelessness to address the underlying structural causes of homelessness. We all know that, shelter is not the solution to homelessness. It's it's an emergency response. But, what are the larger structural drivers of homelessness, including racism? And I think PATH can play an important role in influencing government and others to not just sort of treat the symptoms, but really get to the root cause. And I think what Hanan said, is so beautiful and heart-wrenching about the way racism impacts the lives of Black people, especially, and all of us. And really being open to that and being and sharing what you all know about those experiences with the world so that we can make the changes that are needed.
Hanan, how do you think all of this experience affects our movement to end homelessness?
I think it ties very well to our mission. And, our mission is to end homelessness for individuals, families, and communities. And we can't really do that without looking at the structural racism that exists and how we do that. From a policy level, looking at existing fair housing protections at the local, state, and federal level, and advocacy also on the federal level, looking at national housing market and how do we regulate that and keep housing within reach of all Americans, and really looking at that system that we can create for the most marginalized that will then allow us to serve all humans in that sense experiencing homelessness. On the other piece of it is training our staff at all levels, our board of directors as well, to understand racism and the intersection of racism and homelessness. Education around the fact that race and homelessness ties together, and looking at our data. And I know we started diving into it a little bit as well. Who do we serve, and do they all have that level of access they need to have to the services? And creating positions that are explicitly focused on creating equity-based resources for the homeless population that we serve. I think that's some of the ways we can get there.
Thank you, Shane and Hanan. I know this is a difficult topic to discuss, but this is just the beginning of our campaign to listen, learn, and lead. And we will continue to have this discussion. So thank you very much. I would like to just ask one last question to Jennifer, if you could pull up Jennifer again. Jennifer is one of PATH's staff leaders. I like to say she is the PATH staff leader. So I just want to ask you, Jennifer, given these two significant crises, health and civil rights, where do you see the future of PATH heading?
Thanks, Joel. I think the past few months have been nothing that any of us could have ever predicted or have ever experienced. And the only way that I know how to handle the unknown is really to be as proactive as possible. As Hanan mentioned, our mission is to end homelessness. And our mission is really the thread that links all of our work throughout the state. And we know that homes end homelessness. And we also know, as many of our communities use, that people often have a home before they come to us. During this health crisis, homes also protect individuals from COVID-19. The ability to safely isolate and shelter in place should not be a benefit exclusive to socioeconomic status and race, but rather a benefit for all. And if we can provide a home for every person who is homeless in California, we will also shift the significant disparities experienced by our Black and brown homeless neighbors that will create a culture of equity and inclusivity. The future of PATH includes addressing these systemic barriers that cause homelessness and advocating for change. As the panelists mentioned, we need to move upstream. We need to look at inflow. And while we do this, we will continue to stay true to our mission and push harder for every single person to either keep or to find a new home. Thanks so much for letting me answer that, Joel.
Thank you, Jennifer. Thank you all for listening in. I hope this was just a small part of all of us understanding this health crisis and civil rights crisis. But there's still one other crisis that we haven't talked about. We still haven't discussed the upcoming economic crisis. Temporary protection for unemployment and rental evictions has provided short-term relief, but in the long run, we're really worried that we will be encountering another great or greater recession, if not worse. We're worried that homelessness will increase. So at our next At the Forefront segment, we'll discuss this more with some people on the front lines and some experts, just how this economy is going to affect those of us who are trying to end homelessness throughout the state of California. I just want to thank all our participants, Hanan and Aiko from the PATH team, and Dr. Fitzgibbons and Shane Goldsmith, some of our leaders in our community. In fact, you can learn more about Dr. Fitzgibbons and Shane's work at cottagehealth.org and libertyhill.org. I encourage you to go to their sites and learn more about what they do. And I want to thank the Goalen Group, who have been longtime supporters of PATH and who helped produce this. In the meantime, we encourage you to be part of PATH. We're not a charity anymore. We're a movement to end homelessness. And you can support and get more involved at PATH at epath.org. Thank you all for joining us. We look forward to talking with you again next month and continuing this dialogue. Thank you all.